question if you could indicate your name, your media outlet, and who your question is directed to. And a welcome to those tuning in this afternoon on Rogers Television, as well as the Rogers Facebook page and YouTube channel, listeners on Global News Radio, AM 980 CFPL, and those who are joining us on the CTV London website. We have lots of questions already in queue, so let's get to the opening remarks right away, and we'll start with Mayor Ed Holder.
Well, thank you, Dan, and good afternoon, everyone. I'd like to start with an update on bylaw enforcement as it pertains to our COVID regulations. So in speaking with the head of our bylaw enforcement division, I'm happy to report that while there were several complaints regarding retail stores and individual gatherings, none of those complaints warranted fines or tickets being issued. Even still, I'm of the view that we'd rather be safe than sorry. So we're thankful to all of those concerned citizens who reach out to us when they see something they think might be a little off. That's why we have bylaw enforcement officers who can attend and determine whether any violations have in fact taken place. I will say late last week we issued a pair of fines to beauty supply stores and to one furniture store. So these kinds of things, unfortunately, are still happening. I get that many local businesses are in dire straits. Believe me, my empathy is very strong. And doing all that they can to survive is utmost in their minds on behalf of themselves, their employees. We also know Londoners doing what they can to support them, and we appreciate that. But despite the province-wide lockdown, there are still numerous ways we can support local business while doing so in a manner that's safe and respectful of the various restrictions. You've heard us talk about this, the curbside pickup, delivery, going online. All these things matter, and right now they matter like never before. Separate from that, I want to say I'm proud and grateful to all those who are taking part in Middlesex-London's vaccination program. These are early days and we're still ramping up, but the amount of coordination and level of commitment involved in setting up a rollout of this nature is phenomenal. The objective is to ensure vaccines are administered to our most vulnerable groups as quickly as possible, because nobody here in Middlesex-London wants to have doses sitting unused in freezers. We want those vaccines in as many arms as possible in the shortest possible time frame. And we encourage Londoners, take the shot. As mentioned, I'm grateful for the efforts we've seen so far, and our public health officials, I think, have done an incredible job of setting up the appropriate infrastructure. On my end, I'm in regular contact with the appropriate provincial and federal officials to ensure that London continues to get its fair share of vaccine and that our supply remains constant. So like I said, our intent is to ensure that we receive, that what we receive is used as quickly as possible. And I do not want to see us punished for that. I'm doing everything I can to make sure we're getting regular shipments of vaccine to replace that which is being used on a daily basis with even greater frequency. So with that, I'd like to turn over to Warden Cathy, please.
Great, good. Well, good afternoon, everyone, and thanks for that, Mayor Ed. Well, we're a week and a half into 2021. I don't know about you. I feel like we're a lot deeper into 2021, but the good news is we only have 50.5 weeks to go until the new year. I wanted to take this opportunity today to update our residents on compliance activity with regards to restriction concerns in the county. Over the holidays, the OPP responded to only 2 calls of gathering concerns. When the OPP responded to both sites, they found that those sites were in compliance and no charges were laid. In Strathroy-Caradoc, complaints have been received throughout the whole pandemic between police and bylaw. And at this time, bylaw has responded through education when necessary. And no charges in Strathroy-Caradoc were laid over the holiday period. I want to thank our residents for continuing to watch out to see what's happening in their community. And there are many ways that you can contact municipalities with gathering concerns. But I also want to congratulate our residents for continuing to put the hard work in and doing their part when it comes to compliance. I'd also like to take this opportunity to remind you that there are many resources in our communities to help with mental health stresses that you may be experiencing. This time of year can bring you down during the best of times, but with lockdown restrictions on top of that, we will see an increase on the pressures that we are feeling. So help is available If you know someone who is struggling, find a way to offer support. The Canadian Mental Health Association is a great resource, and through the county can be reached at 519-245-0120. And the Women's Caucus of Middlesex County is currently planning a virtual check-in session for women across the county. This is being held on February 4th. More information will be forthcoming, but please check the social media of our caucus members, of which I am one, for more information. During these times, watch out for neighbors, friends, and family. Always be kind and support those where you can. And at this point, I'm handing it over to Dr. Mackie.
Thank you very much, Burghardt-Jesson and Mayor Holder. So our case count continued to escalate. 143 new cases today, a number of deaths over the past few days. The positive news is on the vaccine front. As of the end of day yesterday, the Agriplex Clinic have vaccinated 2/3 of the long-term care staff in this region. That's a tremendous accomplishment in a short period of time, and a huge credit to London Health Science Centre, which has been leading that vaccination, as well as to all brought their staff out, making sure that people got back. All of long-term care staff vaccinated in the region and climbing. The major change in the vaccine campaign this week is a new focus and renewed focus on getting vaccine out into the homes, into the residents. So as we go home by home vaccinating residents in long-term care facilities, where we know the risk of death is high, we'll also be able to make sure that those staff that haven't had the vaccine yet are also getting that, which will really increase the protection of everyone living and working in long-term care. This is where we've seen greatest impact throughout the pandemic, and so we're very happy to be making that shift. Today, I am down on Oneida Reserve, where the long-term care here has had a small outbreak. At this point, only 2 cases, 1 staff person, 1 in a lab, but because Indigenous people are additionally vulnerable and also prioritized in the provincial vaccination campaign, this is where we chose to launch the first on-site long-term that happened in our region. I'm down here with a team of Middlesex-London Health Unit staff. We've actually just completed vaccinations just now in all residents in the Oneida long-term care facility, as well as the staff who happened to be around, because we did have some extra doses on hand. So that's the beginning of vaccinating a number of these long-term care homes on site, actually focusing on residents over the next few weeks. And at some point, that will be a huge positive. We hope long-term care is where people have been dying anymore. I'll pause there, Dan. I'm sure there are lots of questions, and looking forward to before we do questions, I guess we have Dr. Dukelow here from London Health Science Centre. Thank you to Dr. Dukelow for attending today. I also want to say a personal thank you. I know you have been actually in the Agriplex vaccinating yourself, so thank you for doing that, and to all of your staff who've done such a tremendous job of setting up and executing that campaign.
Thank you very much, Dr. Mackie. Appreciate it. Thank you for having me. Thank you, Mayor Holder and Warden Burghardt-Jesson. I do appreciate the opportunity to join today's briefing and provide an update on COVID-19 and our ongoing battle with this pandemic. LHC continues to work on many different levels to manage outbreaks, prevent further spread, maintain the highest possible volumes of other healthcare activity, and, as Dr. Mackie mentioned, administer vaccines. Before I get into those details on our pandemic response, I want to acknowledge the departure of Dr. Paul Woods as our President and CEO. LHC will be announcing an interim President and Chief Executive Officer in the coming days. While I understand there is great interest in this topic, it is not the focus of today's press conference. I and the other senior leaders at LHC are singularly focused on moving forward and ensuring the stability of our organization during this global pandemic. The entire team at LHC is 100% committed to continuing to serve our community. Moving on, I'm pleased to share that the outbreak on D7200 medicine at Vic has resolved as of this morning. There remain 2 units on outbreak at VH with less than 5 associated cases and less than 5 staff cases. There have been no deaths associated with the current outbreaks. We currently have a total of 39 inpatients that are COVID positive, with 12 of those 39 cases in critical care or ICU. As part of our organization's ongoing pandemic response, at the end of November, we shared that 24 beds were opened at Victoria Hospital to provide additional capacity, given reductions to admissions at UH. Those beds have remained open. To help us continue to manage current internal and external capacity pressures, we are now working to open an additional 26 acute care beds at Victoria Hospital. This will provide additional capacity for COVID-19 patients. The opening of these beds will be implemented in a phased approach, beginning with 14 beds this week. As we battle COVID, we are also continuing to complete as much other care as possible. This week, we are continuing to run 9 of 15 operating rooms at UH, or 60% of the normal capacity. And at Victoria Hospital, we are running 14 of 19 operating rooms. This places Victoria Hospital at 70% of our normal capacity. I also want to address the ongoing vaccination efforts that Dr. Mackie discussed. On Friday, our vaccination clinic achieved our highest volume to date, administering 845 doses on a single day. And pending the availability of vaccine supply, we are continuing to ramp up its capacity to 1,000 doses per day. Lastly, before I finish, I want to express my gratitude towards everyone on the London Health Sciences team. I had the privilege of working this past Saturday and Sunday in the Victoria Hospital Emergency Department myself. Despite being 10 months into this pandemic and all the other challenges we are facing, our frontline team members and leaders continue to work every single day for our patients and our community. Thank you.
Thank you, Dr. Dukelow. Thank you, Dr. Mackie, Warden Burghardt-Jesson, and Mayor Holder. I just want to say that given Dr. Dukelow's statement, as well as the high number of questions we've already received for today's briefing, we do have a lot to get through. So we're going to focus on COVID-19 specific questions from here, and want to thank you in advance for your understanding on that as we move forward. So let's get to the questions right away. Actually, this one, Dr. Dukelow, is for you. What is the latest in terms of the types of procedures and surgeries that are not happening at LHSC since the original release that came out last week?
Thank you very much. So as I mentioned in my opening remarks, we continue to have the same level of operating room capacity or activity that we had last week, maintaining that level. So it would be the priority 3 and priority 4 cases that would be not scheduled. So we haven't been canceling procedures because of the pandemic this week, just scheduling less.
All right, thank you very much. Let's move on to our next question. This is a question again for Drs. Mackie and Dr. Dukelow. And it's a question about board members and senior executives receiving their vaccine. So have there been any board members and or senior executives at LHSC, and I'm thinking at the health unit as well, who have received their vaccine?
I'll start for London Health Sciences Center, if that's okay, Dan.
Yep.
So in terms of the board members, I can't comment on that. I don't know if any board members have received the vaccine, and we leave it up to the board's communications to talk about that. In terms of the executive leadership at LHSC, I know that I am the only one who's received the vaccine. I received my vaccine yesterday, given that I am in part of the group 1 of hospital care providers as an emergency physician. So after my shift yesterday, I was able to go get the vaccine and either as a recipient as opposed to a provider. But I'm the only one on our executive leadership team who's received it.
Thank you, Dr. Dukelow. Dr. Mackie.
Yeah, there are a small number of health unit staff that have received the vaccine, but it's only the staff that are going into long-term care to vaccinate. At this point, we don't have authority to vaccinate anyone outside of the vaccine team that is going into long-term care. And it is really about protecting the residents in those long-term care.
Thank you, Dr. Mackie. Thank you, Dr. Dukelow. Next question is for Mayor Holder and for Warden Burghardt-Jesson. The province says for now they will not impose a curfew. Do you think the province should be calling a curfew? Is the province doing enough as far as restrictions? Mayor Holder, did you want to start on that one?
Sure, happy to. And who's that question from? You used to do that in the old days.
Yes, I apologize. This is from Steve Young at CTV and News Talk 1290 CJBK.
Well, hey, Steve. Look, restrictions of any kind are challenging to populations, be it London, Middlesex, across the province, across the country. So to me, it prompts a few questions, the issues around restrictions, which include curfews. The first is what impact a curfew will have. The second is, will people pay mind? And if they don't, do we have the necessary capacity to enforce them? You know, I also think of other potential questions. So who is allowed to be on the streets? What businesses are allowed to be open? What's deemed an essential worker who presumably would be on the street, who's not? How do you define them? They're not wearing insignias or any sort of separate designation. And so I think there's a lot of confusion around the potential for this. So look, at this point, the Premier has made a decision to not implement curfews. I think he's looking at that certainly day by day, week by week, and I support his decision today. Warden?
Thanks very much for that, Ed. You know, I have to believe that the Premier has put an awful lot of consideration into making that announcement either today. And I would agree with what the Mayor said, that this isn't just being left at the table and walked away from. It'll be something I'm sure that he revisits over the days and weeks to come. You know, that being said, it's from a municipal leader standpoint, especially from a county standpoint, you know, those resources are really few and far between. And, you know, we're fortunate in the county that we haven't had to experience the problematic large gatherings that would lead to a call for a curfew. And, you know, I wonder and I worry about the taxation that it would take on municipal infrastructures to implement a curfew. That being said, if the day comes when if a curfew is enacted, certainly we would support where we can, but certainly I support him in his decision today.
Thank you very much, Madam Warden and Mayor Holder. Let's go to the next question. It's from Carrie Mackie at CBC London. And I think, Dr. Dukelow, this might be a question for you, but Dr. Mackie, by all means, chime in if you have more to add. What is the status of the vaccination rollout at the Agriplex and at long-term care homes? How many individuals have received the shot? Is there adequate supply? Dr. Dukelow, did you want to start there?
I'll start. Thank you very much. So as of last night, it was just under 6,500 individuals have received the vaccine at the Agriplex. So, and growing obviously very quickly with the numbers I announced earlier. And I think, and Chris had said, or Dr. Mackie had said during his opening remarks that 2/3 of congregate care setting workers had been vaccinated, which is just outstanding, excellent news. I will leave it to Chris to comment on within the long-term care homes and residents getting vaccinated. And I think he'll speak to that. Lastly, is there adequate supply? It's a bit of a double-edged sword. We don't have enough supply to vaccinate everyone we want to vaccinate, but we have to look at the equity factor across the province as well. There are parts of our province that have no vaccine at this point in time because it was distributed based on the amount of COVID activity at the time when the distribution started. So do we want more? Absolutely. We need to get everyone vaccinated. But relative to some areas of the province, we have a relatively good supply.
Dr. Mackie?
I think those comments are bang on. I think the campaign is going quite well at Agriplex. Thousands of people have been vaccinated there. We are starting long-term care homes this week. We've completed our first long-term care home already today and several more later this week. On the supply side, I mean, if we had 10 times as many doses, we would be doing 10 times as many vaccinations. When we do the influenza vaccine campaign every year, we essentially, public health is the distributor of the vaccine to primary care, to long-term care homes, etc. And yeah, if we had more vaccine and more availability, as well as more eligibility under the provincial framework, we'd be doing a lot more. We're doing what we can with the doses we have.
Thank you very much, Dr. Mackie. A quick follow-up to that question, Dr. Dukelow, and it comes from Jennifer Beeman at the London Free Press. How many COVID-19 vaccines will be administered at the Agriplex site by the end of today? And has this week's expected shipment of the Pfizer vaccine arrived?
So there are 600 vaccines occurring today, so you can add that to the number that I provided earlier. And I don't know if this week's Pfizer vaccine has arrived as of right now.
Okay, let's move to our next question. Dr. Dukelow, Jennifer Beeman again is asking, is LHSC taking in additional patients from some of Ontario's harder hit regions?
Yes, we have taken in some additional patients from Windsor to the west of us, and there's an ongoing conversations about the possible need for us to take more patients from Windsor. We've worked very hard to create a 15% buffer in our capacity so we could respond both to local and regional as well as provincial surges. So I believe throughout the province there are patients moving, and we will do whatever it takes as a healthcare system to respond to COVID.
980 CFPL, Dr. Mackie, this one is for you. Dr. Mackie, in a series of tweets over the weekend, you mentioned that schools being open is a public health measure that likely slows the spread of COVID. Do you want to see local schools open before January 25th?
I don't think so. I mean, it's not easy for the school boards to pivot on a dime, and so I understand that they will be closed until the 25th. There are other jurisdictions around the world that have been able to use attendance at school to limit the spread of COVID, and that's because you've got a place where students are masked, there is some supervision, and you've got less of this sort of intense close contact without masks on that happens in homes, and that's proven effective in some other jurisdictions. We also saw in the falls that 80 to 90% of the student cases that were students in schools were acquired at home. And we were able to determine that because we tested around 1,000 students over that time who had been in contact with a positive case in school, and only around 1% of those were positive, so likely reflecting background rates in the community and not spread at school. So, you know, we know that no gathering indoors is ever completely safe, but on average, there's pretty strong evidence growing that the indoor gathering in schools, because of all the precautions, is safer than what has been happening on average in homes. Now, that will be different from household to household. You will have households where they have the resources and ability to make sure that there is no gathering indoors. And then we know that there are a lot of people who don't have great options for childcare and other things. And so, you have multiple families gathering or sharing childcare arrangements or that sort of thing. And we know there is spread happening in those environments. We've documented that in the fall as well. So that's the concern. I understand why the provincial government made the decision they did, and completely, support that. And I hope that schools don't stay closed. Obviously, we've talked before about the risks of school closures in terms of educational outcomes, in terms of domestic violence, in terms of food security with students losing access to free lunch programs, for example. Closing schools is not without harms, and it may be something that actually accelerates the spread of COVID.
Thank you, Dr. Mackie. And a follow-up from Andrew Graham. Have any coronavirus mutations appeared in London or Middlesex County?
Yeah, we don't at this point have a lot of capacity to identify those types of mutations. That capacity would be more at the national lab or the Public Health Ontario. We're not getting a lot of that data at the local level.
All right, very good. Andrew, I know you've got some more questions. We'll come back to those. Let's go to a question from Rebecca Rodriguez, who is at the Western Gazette. Dr. Mackie, today marks the first day of the second semester for students at Western. Many students returned to their London rentals this past weekend, despite recommendations from government officials to suspend travel and interaction with individuals outside of their households. Does the health unit believe this will influence the case count in London in the next few weeks, particularly among the student community?
Well, I think the student community is less of a singular issue now than it was in September. Cases in September were dominated by post-secondary students. That's really not what we're seeing now. We're seeing cases throughout the community and throughout the province. And so I wouldn't say that what's happening in those student rentals is going to be really a driving factor. This is now a very dispersed, spread out, community-based pandemic wave.
And there's a follow-up question from Rebecca Rodriguez, Dr. Mackie. As a result of the rise in daily cases in London, will the health unit reevaluate its decision not to publish student numbers?
Yeah, I'm not entirely sure the basis of the question, Rebecca. The student numbers are published by the province, and so you can get that through the Ontario Government of Ontario website. Each school, the number of cases, whether they're on students or staff, and so because of our limited capacity, we're not duplicating the reporting that is already happening at the province. That would be where you want to go to get that information.
All right, thank you very much, Dr. Mackie. Let's move on to our next question. And we are going to take a question from Kelly Grant, who is joining us from the Globe and Mail this afternoon. Dr. Mackie, what do you think of non-patient facing staff at Toronto hospitals receiving COVID-19 vaccines before priority populations, including long-term care residents in London and Middlesex County?
Well, I mean, this is it's easy to say that all of the vaccines should be going to frontline workers and vulnerable populations first. There's no doubt about that, and anyone that's standing in the way of that is really doing their community and the health of their community a disservice. That said, we also had some direction from the provincial government to get vaccine into our arms as soon as possible. So I understand how some hospitals were filling some of their appointments with people that might not have been frontline and just happen to be more available because they're not, tied to patients on the ward, and so they can move around. So that's likely, trying to give people the benefit of the doubt. I believe that's what explains most of those situations. And we do need to work harder to make sure the vaccines can get to those on the front line, serving the most vulnerable as soon as possible, so that we don't have to fill those spots with people who are in a situation where they're going to cause less risk.
Thank you, Dr. Mackie. Kate Davinsky from CBC London has the next question. This is a question for Dr. Dukelow, Dr. Mackie, and Mayor Holder. Within the last 5 days, London's healthcare sector has lost 2 senior leaders at a time when cases are growing and vaccines need to be given out. Dr. Dukelow, what are you hearing about this from your colleagues? And Dr. Mackie, Mayor Holder, how worried are you that this destabilization will have a negative impact on the region's ability to respond to the virus during the second wave? So, Dr. Dukelow, if you'd like to start.
Thank you, Kate. It's an excellent question. No doubt losing 2 senior leaders has a potential to be problematic. However, I am confident, 100% confident in the senior leadership and most importantly, our front lines, that we will continue to be laser focused on responding to the pandemic for our community, and will continue to provide excellent care. That is our number one goal, and which includes the things like containing outbreaks and delivering vaccine, as well getting as much activity as we can done that isn't related to COVID. So is it challenging? Yes. But are we able to respond? Absolutely. I'm confident we will make it through this and continue to provide excellent care to our community.
I would just add that, as you've seen with Dr. Dukelow, with Neil Johnson when he had to step in the spring, and so many others, London Health Sciences Centre has deep bench strength in their management. They will pull through this. They are continuing to be a strong partner in the vaccine campaign. Absolutely, changes at the top can be disheartening, and also we've got the team to continue to make this happen.
So let me add, firstly, leadership matters. And any organization is only as strong as all the players as part of it. The comments around bench strength are absolutely right. And what impresses me about LHSC as it does with our City of London, I'd say the health unit throughout, and these are just the folks who are on this call today, and the irreplaceable warden of Middlesex County. I'm not sure that that's possible, but with the rest, frankly, what impresses me is that if someone is not there, it doesn't matter the reason. I mean, we've got situations most recently that are unfortunate, but it could be a sickness. It could be whatever it might be that puts someone out of operation. But if you don't have a good, strong team, which is all of our obligations, I think, as leaders to develop, then I think it creates its own challenges. But that's not the case here. It's not the case within our hospital system. It's not the case within our health unit. It's not the case within our civic administrations in Middlesex County and the City of London, nor, for that matter, with all respect, at the political level as well. My mother said, "I'm your mother, you could be replaced." And now I am getting a better appreciation for what that really means, because Cape Breton mothers don't lie. But in truth, you're only as strong as the organization that you lead and that you're with. And the measure of any leaders that they can, in our case, not be there. And it's, I don't want to say business as usual, but it does matter that you have the strongest possible team. And we have it in all of these organizations.
Thank you very much, Mayor Holder. Thank you, Dr. Mackie and Dr. Dukelow, for those responses. Unfortunately, we are out of time, and I know that folks have other meetings and other things that they have to get to, and they're already running a little behind now. So I do apologize that for the first time in a long time, we're going to have to leave a few questions hanging. If those are questions that you still need answered, if you could email me at dan.flaherty@mlhu.on.ca. We'll try to get those answered for you this afternoon. Thank you again for joining us. We appreciate it. We appreciate your time, Mayor Holder, Madam Warden, Dr. Dukelow, and Dr. Mackie. We will be back with our next virtual media briefing on Thursday afternoon at 2 o'clock, and we hope you'll be able to join us then. Between now and Thursday afternoon, have a great rest of the day, and we'll see you later. So long.